Hi, I'm Dr. Greg Cason for webbyhealth.com. This may have happened to you. One night after going to sleep, you suddenly wake up. Your heart's pounding, your chest hurts, and you feel like you might be having a heart attack and you're going to die. Then you go to the hospital, and after several tests, you find out you weren't having a heart attack at all. You were having a panic attack. Those with panic experience an intense fear or discomfort that comes on quickly. During the panic, the person experiences several things that may include pounding heart, sweating, shortness of breath, nausea, dizziness, and fears of going crazy or dying. Now, panic is common with phobias. Phobias are those irrational fears of particular things or situations like spiders or snakes. And when exposed to one of these things or situations, a panic attack may follow. Now, by contrast, some people never know when they're going to have a panic attack, making their world much less predictable. But why do some people have panic attacks and others don't? Well, there's strong evidence that we inherit a tendency to be tense or uptight, and this genetic vulnerability sets the stage for us to become anxious if the right psychological and social factors line up. Now, in panic, there's often some stress that leads to the feeling in the body such as dizziness or a fast-beating heart. And then the person with panic focuses on that sensation, interprets it to be an indication that something very bad is about to happen, and then including completely losing control, going crazy or dying, and then the panic attack ensues. Since many of these symptoms of panic disorder mimic those of illnesses such as heart disease, thyroid problems, and breathing disorders, people with panic disorder often make many visits to emergency rooms or doctor's offices, convinced they have a life-threatening illness. It often takes months or years and a great deal of frustration before receiving the correct diagnosis. Approximately 1 out of every 10 people has had an occasional unexpected panic attack, but only 3% of the population goes on to develop panic disorder, where they have repeated panic attacks. And it's also 3 times more common in women than in men. Many people suffering from panic attacks don't know they have a real and treatable disorder. Some are afraid or embarrassed to tell anyone, including their doctors, fearing they'll be considered a hypochondriac. Instead, they suffer in silence, distancing themselves from friends, family, and others who could be helpful or supportive. Now, the disorder often occurs with other mental and physical disorders, including other anxiety disorders, depression, irritable bowel syndrome, asthma, or substance abuse. Anti-anxiety and antidepressant medications are often prescribed to treat symptoms of panic. In addition, a type of psychotherapy called cognitive behavioral therapy has proven to be highly effective in decreasing both panic symptoms and the fear of having another panic attack. Approximately 80% of those who undergo cognitive behavioral treatment for panic disorder experience significant improvement. Now, if you would like information about this or other anxiety disorders, visit the Anxiety Disorders Association of America website at www.adaa.org. If you'd like more information about me, you can go to my website at www.drgreg.com. I'm Dr. Greg Cason for webbyhealth.com. Thanks for watching.